Hi, and welcome back to Pills and Bills. I'm a practicing clinical pharmacist with a passion for teaching and an even bigger passion for paying off my crippling student debt. I did design this top 200 drugs coloring book by myself to help med, nursing, pharmacy students, and techs learn smarter. So grab a pencil, let's color, review, and make these drugs stick together. If you'd like to color along with me, this book is available on Amazon and TikTok Shop. Just search Top 200 Drugs Simplified. And with that, let's begin. All right, today we're talking about amphetamines, specifically lisdexamfetamine and methylphenidate, two cornerstone medications that are used to improve attention, focus, and wakefulness. Both of these medications are prescription only, as well as being Schedule II controlled substances, meaning that they have a high potential for misuse and dependence, but also a clear and accepted medical use when prescribed appropriately. Both of these medications belong to the stimulant class, medications that increase your CNS activity by boosting key neurotransmitters involved in attention and alertness. There's two primary indications. In ADHD, they help regulate focus and impulse control, and in narcolepsy, they promote wakefulness. To remember their class, you can think amphetamines amp up your system. For our mechanism of action, both amphetamines increase dopamine and norepinephrine in the brain, especially in the prefrontal cortex, to improve focus and attention. However, they have a slight difference in how they do it. Lisdexamfetamine actively increases neurotransmitter release as well as blocking reuptake to make more available. But methylphenidate mainly blocks reuptake without necessarily causing extra release. This makes the effects of methylphenidate more controlled but typically shorter acting. And to remember our brand and generic names, we have our PharmaLink phrase. This is just a quick memory hook that your brain can latch onto to better remember the pair. Interestingly, lisdexamfetamine is a prodrug, meaning that it has to be converted in the body to its active form. That slower activation potentially lowers abuse potential compared to immediate release stimulants. An easy way to remember side effects of stimulants is to think of them as activating a mild fight or flight response. All of these side effects coincide with activation of your sympathetic nervous system. Anxiety may occur because of the excess dopamine and norepinephrine available, creating a heightened sense of alertness that can actually tip into nervousness. Patients may experience decreased appetite as these neurotransmitters act on the hypothalamus to reduce hunger signaling. We can see increased heart rate as elevated norepinephrine levels stimulate beta receptors in the heart, and constipation may occur as we see less parasympathetic activity like gut motility. Amphetamines are contraindicated with MAO, monoamine oxidase inhibitors. These are medications that block the breakdown of neurotransmitters like dopamine, norepinephrine, and serotonin. In combination with amphetamines, these chemicals can build up in the body, which can be dangerous if levels rise too high. As a general warning, stimulants can worsen several chronic medical conditions. You can remember which by the mnemonic SCRAPS: suppressed growth, cardiovascular events, Raynaud's, addiction, psychotic symptoms, and serotonin syndrome. Many of these medical conditions can be worsened by increased sympathetic nervous system activity. And that's our review. See you next time.